Sabrina the Ballerina.
Sabrina the Ballerina. She's just super flexible.
We're here for Gonstead, the right way chiropractic.
Welcome to the office. So, as a ballet dancer, you've injured yourself, or did you have something else? What originally brought you to the office?
I got into a car accident a few years back, and I got reverse whiplash.
Okay, so you were hit from behind and you developed a whiplash?
Yes.
Okay, and you had seen other people prior to coming to this office, right?
Yes.
Okay, and then you found our office,
Yes.
and we saw you. We've been seeing you for how long now?
Oh, I don't know.
Over a year,
2.
I think. 2 years almost.
2 years, I think.
And we initially started working pretty intense with you to try to correct all the things that happened from the accident, remember?
Yeah.
So a lot of that stuff has been resolved, and because she's a dancer, she's high competitive and high recreational as well. She just loves it, it's her life. So through the process now is maintaining her so she can perform. And we went from going a lot, couple times a week, we cut back to a weekly visit. It's been over a month now since I've seen you.
Yep.
So what's bothering you today, young lady?
Well, my knees have been hurting more since I haven't been coming to you.
Okay.
Just a few days ago, I landed on my foot from a
Which
jump.
foot?
This foot?
The left foot?
Yeah.
How did you land?
Like
Oh.
that.
Exactly like that?
Sort of.
Okay. So one foot was stepping over the other.
Yeah, I jumped and then.
Okay. So foot, knees, what else is bothering you today?
I've been getting more nosebleeds than before.
Okay.
My neck actually hasn't been that bad. It hasn't really hurt.
I'm getting some heat swings, but not really a reading in your neck today. And you remember like a couple months ago, we actually went really aggressive on the neck. There was a
Yeah.
lot of stuff going on there, and I remember that one visit, we really had to go after it. Good news, lady.
Nothing.
Nothing in the neck today. It's starting right there, but here's what I want you to notice on the meter. So it looks like it's breaking there, but it doesn't. Okay, it was this overswing to there. So I want to do that again. The reading is down here, but there's a lot of heat. When we're looking at the break on the scope for nerve pressure, what we're looking for is a specific deflection back to 0. If it passes that midpoint and keeps going, it can do this. We're waiting for that clear break back to 0. So let's do that again. It goes left, it goes right, goes right, and it goes left again. So it's breaking at that level. And you saw it's the same level, but it switched sides. So there's definitely something going on over here, okay? Let's do it again. And I'm sure if we did it several times, the muscle temperature would negate itself and the true nerve temperature would come out. Okay? Right there. Okay? So we're definitely going to focus on that area. And we got some going down in the sacrum right there. Sacrum, S1. That's S2. Tender there?
S2, yeah.
How about S3? S3 is also slightly tender, but
S2
S2.
is more.
S2. Let's scoot forward. Let's check the pelvis, please. And I want you to open and close the knees. Butterfly. Open and close. Left side only. Moving independently. Very nice. Right side only. Moving independently. Very nice. We're going to focus on S2, okay, for the low back. You can start to see with static palpation. All that's good. It starts to pool there. Right there. Right in there. Round your back some more, please do. There you go. So 7. 1, 2, 3, 4, 5, 6, 7, 8, 9. That's 10. That's 11. 10 more tender there, or 11 more tender? Not really that bad?
No, I can't really.
Do they hurt, both of them?
Yes.
Okay. Let's do it this way, okay?
Mhm.
L5, 4, 3, 2, 1, 12. Starting to get a little crunchy in there. 11 is moving though. 10. That's it.
Oh.
That's the one. Dancers are very flexible, and with her it's at the very end range, so we got to go all the way to the end range before we actually feel that restriction. Okay, Sabrina? All right, so we're going to do 10, T10, S2. We're going to have you walk, and then we're going to work on the knees and ankles.
Okay.
How's that sound?
Yep.
S2, right there. And we're going to set it as a S2 tubercle contact. Now, super flexible. We need to really isolate the joint. Super flexible, and we want to set it right there at the sacrum. That was a great miss. There you go. That's a piece. Walk it off, please. Let's get a little more of the sacrum first here, and then have you walk, and then come back and do T10. Let's cover you up at the back first. Okay?
Yep.
Cool. Knees back. So we're using knee chest table, knees back a little more. Again, super flexible. Her belly button may touch the floor. Let's see. Joking, but not. Okay? Knees back a little more. Your chest is okay there? Your throat is okay? Good. My right knee is going to be on your left glute just to support. All the way down. Bring your knees up a little bit more. I don't want you to slide. There we go. Good. A little more. There you go. Walk it off, please. And that's just to get a good, better stay put. Pretty cool. Keep walking. Walk up on your toes. Definitely got to work on your left ankle. Now for T10, again, she's super flexible, okay? 2, 3, 4, 5, 6, 8, 9, 10. Okay, I'm going to use this strap here to stabilize your neck. We don't want to whiplash the neck, okay? There you go. 5, 6, 7, 8, 9, 10. I'm going to set 10, thumb right on the spinous, using a thumb pisiform. Let's take it down all the way. There it is. Good. Good. A little more. Gotcha. Home run. Come up slowly. Gotcha. Walk it up. So you're here to maintain the structural and neurological integrity of your body so you can dance at your best.
Yes, because tomorrow.
Is that correct?
Yep. Tomorrow I actually have a little tiny performance
Oh, nice.
to end the end of summer intensive.
Let me see. There. T10 is clear. S2 is clear. Let's motion the pelvis. Scoot back for me, please. Just motion it to make sure. S1. S2. Bueno?
Yep.
Yep. Right pelvis. Middle pelvis. Bottom pelvis. Feels good there. Top of the pelvis. Middle of the joint. Bottom of the joint. Feel good, girl. Let's go on your back and check the knees now. The other thing we're doing for Sabrina is we're tuning up all of her extremities. There was a lot of knee instability, ankle instability, right? And what's interesting is when we work on it, keep them tuned up, they hold. But again, you're a dancer and you don't just do light dancing, you go pretty aggressive. So if it was the non-dancer or somebody else, I would say no. If you're not dancing, you're not. But that's not this situation. This situation is, as your mom asked me, just maintain you as best we can so you can dance. Right?
Yep.
Go. And you've been able to for the year, right?
Yep.
Cool. Now, looking at the legs, come over here and let's get a top view this way. And I want to just point out, come from this side, I want you to see. Okay, so let's just look at the presentation. And looking at the presentation, you can see a slight external foot flare, but if you look at the femurs don't look rotated. You can see the rotation is actually coming here at the tibia. It's gone posterior on the external side. It's going to cause swelling and pain on the lateral meniscus, lateral capsule on the back side, and it is bulging. We're going to work on that today. Check the talus. Never mind, that's moving, it's fine. Okay, let's check this side now. Looking at this knee, it looks more here on the inside. So we're going to test it out as well. Tender in there?
That knee has been hurting the most, yeah.
Bulge isn't as bad on the back side. So we have an potential AIN femur on the right and a PEX tibia on the left. Let's check the ankle here. Pretty cool. Ankles are good. So we're going to work on right knee. Let's do a valgus and varus stress. And it gaps kind of both ways. Opens on the outside, opens on the inside. When it opens on the inside though, it's clicking here on the medial side. We're going to set AIN femur.
Oh.
What?
And my knee has been clicking on the top on that one.
On this side? Yeah, we're going to check it right now, the valgus varus stress. So on this side, it actually doesn't even open up on the inside.
Oh.
It's fine. It's on the outside. Okay? So let's go ahead and work on this right knee first, AIN femur, and then we're going to flip over and do the tibia. Okay, so we're going to do AIN femur. To do the AIN femur, traction and hold on the tibia. We're going to place a thenar contact on the medial aspect of the joint, encompassing the whole thing. And it's going to be a straight set, medial to lateral, anterior to posterior, and a slight torque down. There, it's already starting to go. There you go. A little more. Gotcha. On your back, please. Let's use the board now. Get a little more.
Stubborn.
What's that?
Stubborn.
There you go. Okay, now the fun part. Stand up for us, please. Walk it off. Now, just from what we did there, how's that right knee feel?
Good. A little different, I think, in a better way.
We're applying a little body butter on the lateral capsule, and we're going to need to work. Shall I call Jeanette for you? Are you okay?
Oh, no, I'm good.
Okay. So I'm going to work that bulge back in. And the bulge is right there. Feel good there, Sabrina?
Yeah.
Cool. There it is. And I'm just working that capsule back in, lateral to medial and P to A. And what will happen is you start to feel that suck right back in. As soon as you do, that's where you're going to hold it in place, right there. I'm going to hold it in place, maintain traction. Bend the knee, please. Bend, bend. Still maintaining traction. Hold on to the table. Gotcha. Nice. Okay, now we're going to tape it. Elastic on tape. Taping in the direction of the adjustment just to hold it better. Walk it off, young lady.
That actually wasn't as bad as I thought.
It used to be a lot more brutal,
Yeah.
right? Yeah. Up on your toes. How's that feel in your knees?
Good.
Okay, walk on your heels. Cool. Have a seat. Let's tune up your shoulders now. Scoot back for me. AI shoulder. Bring it down. There you go. AI shoulder. Around, over, down. That's it. Ears. You. Ears. There you go. Hands. Stand up. Squeeze my hand. Squeeze my hand. Let's set the elbows. Thumb. Wrist. Fingers.
Yay.
What's with the red, white, and blue?
They've been on there forever.
Since 4th of July?
Yep.
Squeeze. Nice. What did you guys do for 4th?
We went to the Queen Mary.
Nice. Oh! There you go. Squeeze. Squeeze. You're all set. All
Thank
good? You're welcome.
Other than being bruised where you fixed her tailbone, she said like within 30 minutes she felt like so much better.
Very cool.
So we just put arnica on the bruisey part, but her whole
So
spine felt better.
we adjusted coccyx. Cool.
Yep.
That was pretty, it was a good set. It was what, 1 time? 2 time? 1 time.
One time.
Yeah.
Uno.
Uno.
mas.
It was the second
Mas.
time you adjusted.
And you went back to, and you danced that day?
Did you do that? No,
No.
she took that day off.
Okay.
We just iced, like you said, different parts of her spine.
Okay.
We used arnica on the kind of like sore spot. And then she danced the very next day, and she was even able to jump, which was like not even happening before.
Nice.
And she could touch her toes, which she couldn't do before. So she was pretty much back to normal. And then,
What does that mean?
like, as in, like doing what she normally did in ballet, because before
Before this incident.
Yeah.
Okay.
But she actually went even further with it, because the last day, she didn't wear the knee braces
Okay.
on her knees and did the class. The pain increased 2 or 3 points more than before, but not like it had before where she pretty much couldn't walk and was just in excruciating pain. And so everything seems to be kind of gradually getting better.
You want the first piece of good news? Your neck is clear today. It's starting here. Okay, 7. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 11.
Ooh.
Different combo.
Yeah.
Different combo. Now I'm getting a little bit in the sacrum, but let's ask her. If I push on here, because we did coccyx last time. Coccyx
Right.
did well, did very well.
Doesn't hurt. If anything, it's actually making my knee hurt.
By doing this,
Yeah.
we're gonna bump it light.
Yeah.
And
her
what
right
we'll
knee.
what we'll do is the sacrum.
Yeah, but I mean that's
Affecting
because she's
the
been
knee.
complaining about that knee bothering her.
Right side.
Yeah.
All right. So why don't we do the sacrum first? Because we're gonna do it on the side, and then we can do the rest high, lower, knee, chest. Sound good?
Yep.
Now she's super flexible, and the idea with these super flexible dancers is when you're getting to that point of resistance, it's gonna look like she's twisted a lot. You want to keep things as straight as possible. The idea is where you're adjusting, like at the sacrum here, that's where you want the thrust to come through. Almost. There you go. Not a lot. Just enough. Walk it off. Up on your toes. You know what? We're going to need to do more of that on the high low. Let's go to the high low. There you go. All right. 5, 4, 3, 2, 1, 12, 11. Now she's super flexible.
She's holding her breath, that's why.
We're gonna come back to that one, okay?
Mhm.
We're gonna do sacrum. We're gonna then use the knee chest for that. We're not gonna get it here. Cause she's just super flexible. Super flexible. Try it again. Knee chest. Very super uber flexible. I do need the knees back. That's it. Okay. Now we went to this table for T11 just because you're just super flexible. There you go. There you go. Beautiful. Home run, lady. Come up slowly, didn't sting you, right?
Nope.
Was it fun? No. Really?
That
wasn't, I didn't.
She
Really?
likes that, dude. She's funny.
That wasn't very fun. Maybe. Okay, walk it off. Focus on the food. Clear up top at 4. Clear at 11. Clear at the sacrum. Cool. Let's do the shoulders. There you go.
Hi.
Let's go to the back.
Sometimes it's green. Seriously.
Yeah.
I don't know why.
Well,
It's green after point shoes, Sabrina, when your feet are all squished in those point shoes.
Oh, maybe.
there you go. Slide up that way, please. You gotta set the cuboid. Oh. So you can see right here, it's puffy right at the
Yeah.
cuboid. Ankle's feeling better though.
Mm-hmm.
I need to do the first metatarsal and the cuboid.
Okay. Ooh.
First metatarsal.
She likes that.
Close. Swelling came down. Still a little bit. Bend the knee, please. Alternate move with the speeder board. There you go. Look at that face.
That's a happy face.
Yay! Walk a little bit, make sure everything's good first before I do your elbows and wrists. Walk up on your toes, please.
How they feel.
Bueno?
Mm-hmm.
Have a seat here. There's 2. Okay. This thing just doesn't want to stop today.
Yeah.
Hmm?
Not so.
Hmm? Let's see. There more. There more.
There, yeah.
Distal radius. Almost. There. Let's put some tape on it, okay?
Makes you feel better, she'll keep it on longer.
Yeah. Well, minimum 24 hours. You can keep it on longer. Go, my
This is
dear.
like you fixed it last time, but then after a while, I think grabbing on the bar, because they pushed to pirouette,
Mhm.
and they grabbed, so I think it kind of pulled it back out.
I gave you tape last time?
No,
Why don't I give you a roll? Why don't you just taper? Just taper right now for the next week or 2. So
okay, so it could heal.
Yeah, and you don't
It's
want
okay that it's a little tight, right?
If it's a little tight, no,
Yeah.
it's not okay. We don't, normally I put a white tape on top of it, but I think for her, this should be fine.
Yeah.
It's elasticon. Just want to have a little bit of tension
Stretch
on
to
it.
Yeah.
a little
That's
bit
it.
of tension. Okay,
Okay.
okay.
Nice and simple. You're all set, young lady. Sabrina the Ballerina! How you doing?
Good.
We're just doing a little update. And the update is kind of from where we started. We started a while back. 4 years? 5 years?
5 probably.
5 years,
Yeah.
okay. And now we're just kind of tuning you up, right? We're just tuning you up
Exactly.
now. And the idea is what we were doing back then, we were doing a lot of stuff. There were a lot of complaints,
Yep.
right? As a dancer, as a ballet dancer, hips, knees, ankles, elbows, ribs, everything was hurting, everything was out. And you were still growing.
Yep.
And you're still growing.
And I had whiplash from the car accident.
Correct. And then the car accident kind of put a monkey wrench in everything.
Yeah.
We took new films and we discovered a couple of things now. And we decided something a little different on this round. And we decided that we're not chasing all these things, right?
Yep.
And it took a while because even with mom, sorry mom, is telling, this hurts and that hurts and this hurts and this and this and this. And we had to kind of say, listen, let's focus on the foundation. Let's get the foundation right. Let's get the spine right. And let's not chase it.
Yep.
And has that been more beneficial for you?
Yeah, I think we found last time, did you say that my adjustment has been holding longer and better than it was before?
It is from what I see, but what about from what you see?
Well, yeah, I mean, not chasing things, then everything else kind of, just by finding the spots in the spine,
Yeah.
everything else kind of settles into its place, and I don't have such like weird different pain and different, like I had my knee problems before and
Yeah.
they haven't come back.
Did we adjust the knees again?
Not for a while.
Yeah, we did.
No.
But before we were having to
To
adjust
adjust the
them all the
knees,
time,
yeah.
right? And it goes back to this, and I'm being a little bit more straightforward now with people that, it's educating them in terms of what is the real issue. The real issue is the foundation. Your knees are a result of the foundation.
Yeah.
Unless there's a specific knee injury, we're not chasing that symptom. And I think the point I'm trying to make here, Sabrina, is as I'm working on your foundation, your other stuff's getting better.
Exactly.
As I'm working on your neck, it's getting better.
Yep.
Okay. Anything new? It's okay if
nothing
there is.
new.
What are you feeling today?
Today is just my neck and
Okay.
then my hip, like clicking
Left
is
hip?
back. Yeah.
Okay.
But I've had that for a while.
Okay, and we need to talk about this because I want to go over your x-ray, just the foundation part. We have a left PIEX. We have a rotated right sacrum, drop 2 millimeters on the right. Okay? We have a measured difference of 4 on the right. Means your hip is 4 millimeters slightly lower on the right, so the left is going up a little into that hip. If we fix your pelvis, we make that worse, it's 7 millimeters.
Yeah.
So we said that the fix is in your sacrum, and we have to bring that sacrum up on that side. So let's do the analysis and let's see what's going on. Upper neck is clear. I'm getting it at the base. 15 points. T2, left side. Doo-doo. Now you're saying the left hip is clicking, yes?
Yes.
Okay. Mid back is good so far. It's down in the low.
The basement.
Down in the basement, we got P1 through P5, or S1 through S5. It's down low. Now here's the interesting part. It's actually swollen today.
Interesting.
It's right here around S4. Static palpation. Let's see the overall feel. You can see starting here, this whole left side is swollen. Right there is where it starts. All the way down, all the way down. And it goes into the left side. Let's check the right. So the swelling starts there. It's not as bad as the other side, but it's there. And then kind of disappears. The puffiness is in the sacrum. Now, here's what's interesting. She has the PR sacrum, right? The right side. But I'm getting it low. I'm getting the tilt coming from S4. It's tilting like this at S4. So I need to be down in S4 and torque it up to get that side up. That's not fixing that or that. That's fixing that. Back slowly towards me. Number 5. And she's super flexible. S1, S2, S3, S4. Yes?
Yeah.
You feel that? On the
A lot.
left. Hold on.
Oh.
There it is. Yes?
Hallelujah.
Yes? Yes. So what we need to do is we need to bring that, hold yourself there.
Okay.
I need to be down here and we need to bring this up. That's where it needs to be. 7. 1, 2, 3. 3 more tender, 2 more tender.
2.
2, right, left. 2, right. Let's see what 2 shows up. 1, 2. 2 is showing up as a PRI. So it's this is 1, this is 2. Posterior right, inferior on the left side of the wedge. So we have a T2 PRI, we have a S4. Those are our majors. T2, S4. All right, now here's the question. Sit up, please. You said you got click.
Yes.
Tell me about the click. Show me the click if you
Oh,
want.
show you the clip?
Yeah, show me the click. What's happening?
When I, like in ballet, everything's turned out. So when you go from like straight to turned out, it's like
Keep going.
very minimal.
I'm feeling it back here.
Both of them used to do it, but now it's just one.
Now it's just the left.
Mm-hmm.
Bear with me here, okay?
Okay.
1, 2, 3. Go. I'm on the outside. Go. 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 We'll deal with that coccyx later.
Yeah.
You see what I was doing? So I'm feeling the click in the back. You're feeling it in the front.
Yeah.
All right, let's do S4. We'll start it here on the side, then we'll go on the knee chest table, and we'll do T2 as well. 1, 2, 3, 4. I'm gonna do middle finger contact right there. You feel that one?
Yeah.
Yeah. And we're gonna do, dude, you're super flexible. Nice. Gotcha. Let's walk it off, please. Let's go on the high low. T2 as a PRI. There you go. Nice. S4. 1, 2, 3. Now what I'm going to do is I'm down lower on S4. We're going to get more torque. This one. My knee is there to support. Okay. Drop it down. A little more. There you go. Nice. Oh man. Let's walk. Good stuff. Good. Bueno?
Yes.
Have a seat, please, and let's rescope and let's see what happened. T2, S4. Ah, T2 is clear. S4 is clear. Very nice.
Ta-da!
Let's check. Look, the swelling is down. Cool. Back slowly towards me. S1. S2. S3.
Ta-da!
Low. different.
Yes. Oy. That's a little
Tender or sharp?
tender.
Okay. Feet together. Open and close the knees. Open and close. Open and close. Right side only. Open wider, please. Good. Left side only. That's a diferente.
Yeah.
Different on the hip.
Mm-hmm.
Left hip.
I don't know. I have to try.
Go see.
Okay.
I'm not expecting all the clicking to go away, but
Yeah.
tell me if it's different. Let's go back over here.
It's not as deep. That's how I would explain it. It's way less.
The sound is there,
Yeah.
but how's the feeling?
The feeling is less deep. It's not as.
So we have two parts here.
Problem.
We have to fix the sacrum, then you got to work the ligaments. Okay?
Okay.
Let's go over here. That's a muy bueno.
Yeah.
That's a bueno. Sit up and turn. Ears. And let's buff out the low back. And 2-2. Squeeze. Questions.
No.
We're good. There's nothing. Loosey goosey. Welcome back.
Thank you.
You take care, okay? So since our last visit, less poppy, less cracky,
Yep. In the hip.
and pop, pop, pop. This one, left side.
Yeah, left side.
Okay. Shall we get started?
Yes.
Let's see what's going on. When Dr. Rahim has lunch, and then he goes for coffee, and then he has this vegan, gluten-free brownie and donut. It was a mini brownie.
What'd they put in that
Chocolate.
brownie?
So there's no gluten and it's vegan, but dude, it's a lot of sugar. So don't be confused by vegan and gluten-free. It's still a lot of sugar. And if you ain't breaking down that sugar, what's going to happen to the sugar?
You get crazy.
You go crazy. No, this is me burning the sugar.
Oh, okay.
Then it turns into the adipose tissue. All right, I'm getting pressure at the base of your neck. 5 points. So it looked like there was going to be pressure there, but it keeps going. We got about 13 points sacrum. She got a puffy sacrum today, Mama. Check it out. Check it out. Check it out. That's a puffy sacrum.
Oh,
Hi,
that's a
everybody.
puffy sacrum.
Hi, everybody. That's a puffy sacrum.
That's a very puffy
It's
sacrum.
a marshmallow.
And she's twisted that way. So the sacrum is out and the pelvis is out. Feet together.
Yep.
Open and close the knees. Open and close. Left side only. And watch my right thumb go with it. Zoop. That's the rotated right sacrum. Do the right side only. And when she does the right, the left is okay. But if I put it here, watch this. Oh.
Oh, yeah.
The sacrum moves with it. So, sorry, the pelvis moves with it. We have both the rotated sacrum and the pelvis. So we need to make an educated decision today
Yeah, last
for
time.
her foundation. Last time, what did we do? Do you remember?
It was both last time.
We did gangster, right?
So we chose one again last time, right?
Scoot back.
You did. I think it was sacrum last time.
I think so.
Head down. Tender.
Yeah.
More tender.
No.
It's sacrum. All right, so we got C6. That's dope. C6. That's not moving. It's crunchy.
Caramba.
That's a crunchy. That's a crunchy. Right hand up.
Caramba.
Right hand up. We're going to do C6, right side. We're going to do, is that okay for you?
Yeah.
Okay. C6, right side. You know this one squiggly is just bothering me. Can I just down. Oh, down. No, denied.
They denied it.
I didn't deny it.
Denied. Come over here. The knee chest table is designed to use gravity to help assist us. We are doing a right rotated sacrum. So guys, I'm going to show you on a spine model. So let's understand the mechanics. That's where we're at. So we're using gravity to assist because when we're in this position, I need you to get all of me here too. So here's the deal. When we're using the knee chest table, comfy? Not, right? So why does Dr. Rahim get you on all fours? Because we're using gravity to assist. This table was designed by Dr. Gonstead. And the idea is as you let the stomach drop down, let it hang, it opens up those vertebral bodies. We lift and set. It's an easier adjustment if the patient receives. Rotated sacrum on the right. This right side has gone back. We're coming in this way. It's kind of like a knife edge contact. And you'd see me or hear me in previous videos say I'm bringing my knee right here, right? And I'm bringing my knee right here because I'm adjusting it into me this way. So rotated right sacrum is P to A through the plane line of the joint, this way into the doctor's knee. Cool? You ready? Sabrina the ballerina. Knees slightly together, please. That's muy bueno. My knee is here. And maybe we get a crack, maybe we don't. But the goal of the adjustment is not to get a crack, it's to set. Right? A little more. There you go. And there was no crack. Come on up, my dear. Walk it off.
I like to be awake, but I like sleeping.
Well, we all need our sleep.
That's right.
Walk it out. Cool. And the next thing we're going to do...
What do you do with my other squiggle? Where did it go?
It's there somewhere.
Over your
Go right side down, please. Pelvis. Good. And we're just pushing it PIEX straight through, torque down, just like that. Easy peasy. Easy peasy. Let's walk it out. You see how the sugar's wearing out now?
okay. We'll go get you another brownie.
Y'all good? No.
No more brownies.
Have a seat. Scoot forward, feet together. Open and close the knees, please. Open. Oh, look, the swelling has come down.
Oh, yeah, it has.
It has. Feet together, open and close. What, you thought I was kidding? I was like,
Yeah, that's
right side only? Yeah. Left side only? Yeah. Scoot back for me. All good?
Yep.
All the way back? Bueno?
Mm-hmm.
All good?
Si. Senor.
Senor. Let's rescope up top. I didn't do the neck, right?
No.
There's a reason. You know why?
Because we don't chase.
Well, there was pressure there. I went for it, didn't go. I wasn't going to force it. And if I would have done any more than that, what would have happened? Twist. And we're not trying to twist, are we?
Mm-mm.
And guess what?
It's gone.
It's gone bye-bye. That's a bye-bye.
Peace out.
Don't let me get in my zone. I'm already in my zone. Guess what?
Looks pretty.
All clear.
Oh, almost. There's heat.
That's because the swelling's going down.
There's heat.
Flushing.
There's heat. There's a tiny little bit, but it's more heat. And as I do it a few times, it'll zero out. All clear. On your back, please. AS talus, medial tilt. Lift it up. AS talus, medial tilt. Posterior tibia on the inside. Dirty. I'm just tuning, by the way. Yeah. More here or more here? On the back or the
Inside.
middle? Inside. AIN femur. Bueno. Walk it out. You're all set.
You've been tuned up like a violin.
That's right.
Walk on your toes, please. What kind of dance you do again?
Ballet.
You do ballet? Is that?
Hip-hop.
Guess where I went yesterday?
Where'd you go?
Went to Dancing with the Stars, the tour.
Oh, that's so cool.
Squeeze. We take care of one of the dancers.
Yeah, you
and
said.
invited us over, and it was a phenomenal show. It's pretty cool. Squeeze. Questions?
No questions. I never have any questions.
Say hi.
Hi.
Say turn. Say hi.
Hi.
Hi. Gotcha. Hey everybody! Guess who's back?
Sabrina the ballerina.
Sabrina the ballerina. What are you back here? What are you doing back here?
I messed up my adjustment doing a dance move yesterday.
What'd you do?
I did a grand ma side kick
Okay.
right before I leaped
Mm-hmm.
with the right leg supporting
Mm-hmm.
after just being adjusted yesterday
Mm-hmm.
on the left side down,
Mm-hmm.
adjusting my,
I'm gonna explain that.
okay,
Let's rewind a little bit.
okay,
Yesterday you were in for your adjustment.
yes,
You were here for your checkup, right?
yes,
And we found something different. And we've been dealing with these hip clicks for quite some time.
yes,
And you're doing competitive dance?
yes.
Okay. And just dance in general as well, right? Let me
No,
rewind. Let's do that
Just
again.
ballet.
So you're competitive ballet? Or,
Russian style Vaganova ballet.
oh, excuse me.
You want to be detailed?
All right, I want to be detailed. It's all about specificity.
That's
sure.
right.
All right.
Because we're here for Gonstead, the right way chiropractic.
Ooh. Sabrina's been with us for many years, since she was 10.
Yeah,
Yeah, since you were about 10.
almost a decade now.
Almost a decade now.
Cool.
Crazy. Now, what happened yesterday? I found something different that's helped the clicking of the hip that we've been
Yes.
dealing with for so many years. And it didn't follow L5 sacrum, massage, rehab. We did everything. And you've done everything. I found a connection from the S5 coccyx that was affecting the ligament from the coccyx to the pelvis. And so we did that, the click was gone.
Yes.
I have a feeling it hadn't healed and you went straight to doing your Russian ballet.
Yep.
I'm not telling you to stop.
Yeah.
If you stop, it heals faster. If you don't, I'm seeing you through the process.
Yeah.
Are we cool with it?
Yes.
All right. So now, you did for those of you guys who know ballet and moves,
I did a jeté into a développé to
I
the
did a
side.
jeté to a développé, you know?
On the right supporting leg. And as I did that, I felt something on my right side in my lower back,
Okay.
which caused first pain in my lower back
Mm-hmm.
and then a little bit of loss of like sensation
Okay.
and like a buzzing in my whole right leg that required me to sit down and I could not finish class.
Got it. And today?
My low back constantly aches ever since I got out of bed. I slept fine though.
Okay. You ready for me?
Yes.
Let's do it. Starting at the base of the neck. Do. Hi, Sasha.
Hi, Dr. Ray.
All right. Your neck held and is clear. Good. T3, T4, left side. Do. Let's see how the rest of you did. Down in a low. Right. At the bottom, that's that S5 coccyx, okay?
Yep.
Cool. Now, let's see what happened up here. Static palpation, running the fingers down the spine. 1, 2, 3. Numero tres. 3 or 4?
4. Yep.
4 and S5 coccyx. Okay. So what I was doing is setting the coccyx to S5, okay? And let's go ahead and do it. I'm doing this as a pull move, slide forward. Now, you feel that right there?
Yes.
So this is the coccyx here, this is S5. I'm gonna tissue pull and be very, very firm on it right there, okay?
Okay.
Got
Yes.
it?
Yes.
We're gonna hold. No, I can't, I'm losing you. I'll be this way, okay?
Okay.
I'm gonna be on the tissue on the outside there,
Okay.
right there. But I need to be on the skin here.
Yes.
Okay. Hi. And we had a similar case of a ballet dancer. We did the coccyx and it helped the hip. There it is. Almost. Good. Gotcha. Nice. Come up slowly, please.
Not as crunchy as yesterday.
Not as crunchy as yesterday. Walk it up. Mhm. Hi. How's the hip? Come here.
Better?
Stand over here, please. Okay.
Okay.
Up and around.
Better.
Let's do the right side. It's not clicking there.
Mm-hmm.
Left side again. Tiny, tiny.
Tiny, tiny. Much
Do the move. Do the move. Can you do it?
not like just the part, like the first part?
The part that did it.
Oh, okay.
That's what you did?
Yeah,
That speed, that everything?
pretty much, yeah.
One more time. Smile, don't forget to smile. Something pop?
No,
That was it.
I felt it in this hip though.
Right side?
Yeah,
Doing what?
the kick.
You felt the kick on the right side again?
Yeah, but not in my back, in
In the front.
the front.
Go on your back here. It is a little crunchy in those hip flexor tendons and ligaments. Let's try it again. One more time. Come on up.
The same move?
Yes, ma'am. I need to make. Do you need to hold something?
No.
Then do it.
It's better, yeah.
I want a little more. Let's do it a little bit. We're gonna do it right side down. There you go. I gotta hook it nice and firm. And we're bringing it over. You okay there?
Yep.
Mm-hmm. She's super duper flexible. That's what I wanted. Hold on. Come on up. Walk it off once and let's try it again.
Okay.
Good times.
Good times.
Good times, girl. Let's try that again.
It's better.
Better.
Yeah, it's still sore. I think it's just like,
It's
Sore
sore,
from
but it's not
before.
clicking a lot.
yeah.
So Sabrina,
Yes.
you've been here quite some time. And you've also been to other Gonstead doctors, right?
Yes.
Don't we all gown, right? We all put gowns on for the
Yes.
most part, right?
Yes.
Because a lot of people made some interesting comments over the last few months, and I think part of it is that all the chiropractic videos that are being flooded on the internet are all the same stuff of all the general cracks, right?
Mm-hmm.
In the Gonstead work, guys, it's all about specificity in the analysis, specificity in the adjustment. And the question becomes is this. So number one is we're doing instrumentation. How do you do instrumentation with clothes on? It doesn't make sense. Static palpation, visualization. How do you visualize swelling, edema, pits, blemishes? All this stuff is information in the objective exam. And without seeing it, feeling it, you're kind of guessing. But here's the other thing. It's very easy to slip off the segment. If I'm adjusting here and I need to be on the spinous and I don't take that tissue out of the way and it's loose, one could slip onto a rib. One could slip on the segment above or the segment below. Now, if your intention is to just make some pop sounds and get an endorphin release, then it doesn't actually matter what you do, okay? In this work, we're analyzing, we're looking for that pressure. We want to see what we're dealing with. We want to feel. And yes, this is a skin-on-skin system or skin-on-skin procedure. The only exception I did today was I was down low, so I was on the tissue or on the clothing on the top, but I still needed to be on the skin to get a firm grip, right?
Yes.
1, 2, 3. T4. One more. Good job.
I could say I've been to chiros for 19 years and I've always worn gowns. So,
You've always worn gowns, right?
yep.
Yeah, and your mom too.
Yep.
Mom used to bring you. Yeah. And then we're going to do the post scope. And again, not every Gonstead doctor post scopes. It's not a good or a bad thing. My mentor post scope, I was taught to post scope. One of my mentors used to post scope, and so I post scope. All clear. Okay, Sabrina the ballerina.
Yep.
Now, what I would like to do today is Wednesday, okay?
Yes.
I want you to still go and do your thing. Go dance, don't stop. And you're gonna come in on, you have practice today or tomorrow?
Yeah, I practiced today. I wasn't gonna go.
You can go. That's up if you want.
Okay.
You don't wanna go?
No.
Then take the day off. Tomorrow you go?
Yeah.
Friday you go?
Yes. And
My-
Saturday I perform.
Saturday you perform.
I have a nutcracker on Saturday.
You have a nutcracker on Saturday.
Yes.
You see me on Friday then. Is it possible to get here Friday?
Yeah.
I'll see you Friday.
Okay.
Stand up. Squeeze. Squeeze. So T4, and it was coccyx S5 as a pull move today. Take the day off then. Tomorrow you practice.
Yes.
I see you on Friday.
Yes.
All right? Take care.
Thank you.
Bye.